Okay, so cardiomyopathy is the disease of the heart muscle that is associated with cardiac dysfunction. So our common types that we're going to hear about are dilated cardiomyopathy, hypertrophic, and restrictive. For any of the cardiomyopathies, basically for your pathophys, you're going to have a decrease in stroke volume, which is going to stimulate that sympathetic nervous system and the RAS system, which is going to increase our systemic vascular response or resistance, and it's also going to increase the sodium and the fluid retention that we have, which is going to increase that workload on the heart. So, for cardiomyopathy, we're going to think of this as a balloon. So this is a normal heart right here, right? We can squeeze it, everything's great, it's nice and soft. Okay, so for dilated cardiomyopathy, dilated is when these ventricles down here become very significantly dilated. So I'm not going to blow into this because I had some trouble earlier. But basically, if I squeeze this, these ventricles are going to get bigger, right? So basically, the heart is able to fill with blood, but these muscles now have become so thin, kind of elastic-like, they're not able to pump that blood out effectively. So that blood is just kind of getting stuck down in there, which is causing these ventricles to enlarge. And now we're not really, being able to push that out of the heart. It's just kind of staying in there. Hypertrophic cardiomyopathy, I'm going to just touch on it a little bit. Basically, that is a more of a genetic problem. So I'm not really going to go too much into that. But for restrictive cardiomyopathy, I have some new stuff here. So for restrictive, think of this as like a good heart, right? This has been soaked in water. We can compress this pretty easily. That water can move top to bottom. It can come out, right? For restrictive cardiomyopathy, basically the heart muscles are now very rigid. So they're not really able to effectively fill with blood because these muscles are now so stiff. And, because they're stiff, they're not going to very effectively compress to be able to get that blood out, kind of like this one is. It's just not really going to go anywhere. So restrictive like a sponge, dilation like a balloon. So what are we going to see in these patients? Typically, most of them will have no symptoms at all, but as the disease will progress, so will their symptoms. So when they do eventually start having symptoms, we're going to see stuff like the heart failure. So we're going to see the fatigue, the cough, the orthopnea, the peripheral edema, stuff like that. So how are we going to diagnose this? So we're probably in the early stages going to see tachycardia, maybe even hear some extra heart sounds, the S3, S4. A good indicator is an echo. We could also do a cardiac MRI, a chest x-ray. We could even go as far as a cardiac catheterization, a coronary CT, or even stress testing. For that hypertrophic cardiomyopathy, that is more genetic, so we could do genetic testing for our patients for that. So medical management. First, we're going to treat. We're going to identify and treat the underlying cause. We're going to correct that heart failure symptoms with medication. So those are our ACEs, our ARBs. Stuff like that. We're also going to do a low sodium diet. We're going to get them started on an exercise rest regimen. If they have arrhythmias, we're going to control those with the arrhythmia medications, and we could possibly go as far as implanting an ICD. If this gets to the extent that they need surgery, we can do surgery as well, but first we want to try and treat with medications first.